STOPHF is a novel concept in cardiovascular prevention. As the number of people with cardiovascular risk factors and cardiovascular disease increases, it has become increasingly difficult to identify those people most at risk of having an event such as heart failure. This is due to better risk factor control, as well as the large numbers of people developing these conditions. The STOPHF study sought to find a new way to better identify the people at risk of developing complications of heart disease, such as heart failure. It used natriuretic peptides to identify the group most at risk. Natriuretic peptides are a hormone produced by the body in response to stresses such as ischemia or volume overload, and therefore are a person's own response to the body's stress. In the STOPHF study, patients had a BNP blood test done, and if the BNP test was greater than 50 picograms per mil, they had intensive intervention with a review by a cardiologist, an echocardiogram, and other cardiology investigations as required. Overall, this study showed a reduction in not only heart failure, but also a range of other cardiovascular events such as stroke, atrial fibrillation, and DVT and pulmonary embolus. This study has now ended, but the service is still provided in St Michael's Hospital Dún Laoghaire, where you can refer patients with cardiovascular risk factors such as diabetes, hypertension, a history of ischemic heart disease or valvular heart disease for assessment. It is now also making international impact, which has been now cited in international guidelines in the United States, such as the American College of Cardiology guidelines and in the Canadian guidelines. It was also awarded the Royal College of General Practitioners Award for the Best Research Paper